So good morning all. Today our group is going to present our presentation on Fortis Hospital, and our group members are Sajdev, Ashutosh, Tisha, Saurabh and myself Aditya Sain. Now I'm going to call Saurabh for the further introduction.
So coming on to the introduction and objective. The Fortis Healthcare was founded in 1986 and headquarters is based in Gurgaon and has an operates in 27 hospitals with around 4,700 beds and serves around nearly 3 million patients and specialize in cardiology and neuroscience and organ transplant. The project aims to analyze the Fortis service operations from planning to deliver the quality management by identifying the strengths and efficiencies. Benchmarking against Apollo and Max Healthcare helps highlight performances gaps and frameworks such as service blueprint, lean healthcare and benchmarking guide the analysis and recommendations. The next slide will be presented by my colleague.
Morning everyone, I am going to present the context and objective of the project. So context is healthcare, which gives service-driven complex and resource incentives. Efficiency directly affects cost, quality and patient outcome. Then objectives, analyze Fortis service operations, which include planning, delivery and quality. Then identify strengths and inefficiency, benchmark performance versus Apollo and Max. Recommended improvements for efficiency and patient satisfaction. Then framework applied is service blueprint, ServQuel and lean healthcare.
Now I will talk about service operations analysis. So Fortis Healthcare Limited company overview is like the industry position of this Fortis Hospital is one of the India's leading integrated healthcare delivery service providers. Its business verticals are hospital, diagnostic centers and daycare specialty facilities. The scale of operations are 33 healthcare facilities across 11 states including joint ventures and O&M facilities. Network of around 5,700 operational beds, 400 diagnostic labs and supporting medical services. The core strength of Fortis Healthcare are strong pan-India presence with a focus on quality healthcare delivery, advanced medical infrastructure and specialized patient care. Thank you.
So now I'm going to talk about the service quality and benchmarking. So Fortis Healthcare ensures the quality through NABH and JCI affiliate hospitals, and the Fortis operating system or the MSO plays a key role to process the standardization across hospitals. It also has an NIS-based feedback, patient feedback, which actually calculates and monitors the patient's feedback. If we look at the benchmarking table right now, so Fortis has somewhat around 4,750 beds, which is less than the Apollo and the Max. And the occupancy of the Fortis is somewhat around 69%, which is more than Apollo but less than Max. And if we talk about the time which they allow the patients to stay in the hospital, in the Fortis it's 4.19 days and in Apollo it's approximately 3 days. Now overall this benchmarking exercise shows Fortis is competitive but has a clear improvement opportunities, especially in reducing the ALOS efficiencies and optimizing the ARPOV for higher revenue. Now moving on to the next slide. Operational challenges which Fortis faces. Despite its strength, Fortis faced several operational challenges. The first one is underutilized capacity. As you know that the Manasa unit has the occupancy somewhat around 38%, approximately 38%. So it is inefficiency in the resource utilization, and workforce related issues also stand out at attrition, burnout, process inconsistencies, uneven adoption of the Fortis operating system, as there are gaps in the service standardization, so that they have to look into it. And the last that is patient pain points. There's a lot of waiting time when the patients used to complain about their issues, and there is also the discharge delays, because whenever the day is allotted for the patients to get discharged, it got delayed frequently. And there's also the issue about the navigation inside the hospital. So moving on, I'm going to call my teammate Tesha for the further explanation.
So now I would like to tell you about the recommendations. There are two recommendations that Fortis Hospital has strategically implemented. First is strategical implementations and the second is tactical implementations. If we look into the strategic implementation, then the time period is between 3 to 5 years. They have implemented digital transformation such as artificial intelligence, diagnostics, telehealth care and EMR systems. Also, if we look into the specialty focus, then oncology, robotic surgery and organ transplants were also there. And further, if we look into the geographical expansion, then the tier 1 and tier 2, tier 3 cities were mostly focused. And at the end, if we look into the brand differentiation, then their first was that they should focus on the patients first, and then tech-driven care was also there. Then if we move on to the tactical strategic implementation that they implemented, the time period was 6 to 18 months, and the first was reduce ALOS, the pre-known discharge and discharge planning was there. If you look into the improve occupancy, then corporate tie-ups and medical tourism was there, and the workforce upscaling, then patient experience, cervical surveys were there, OPD cycle, time reduction, so there were such systems were there. And also at the end, if you look into the real-time dashboards, then occupancy, wait times and cancellations were there. Thank you.
Coming on to the conclusion, Fortis equals to the strong foundation, but gaps in efficiency and quality. Level for improvements as ALSO, ALOS reduction,